Hey, fellow YouTubers, it's me, John LaValle. Listen, I'll tell you something about hospitals today. Hospitals today is an industry. It's a big money industry. It's not really concerned about health care. It's more concerned about how much money it can gather because there's huge paychecks involved in medicine. Equipment is very, very expensive. The minute you declare it as a medical item, all of a sudden the stuff is worth a fortune. Did you know that hearing aids cost less than $30 to manufacture, but will cost you $3,000 to get one? That's how much money is the minute you declare it as a medical device. Same with prosthetic limbs. The total cost of a prosthetic limb is about $100, but when you get it, it's $4,000. Same with wheelchairs. I have a wheelchair that cost over $5,000. Now Canadian Tire puts one out for $69 on sale, and it's just about as good as this. In fact, it's sturdier than this one. So, anyways, that's the business of in hospitals. If you've noticed, the doctors are no damn good either. Big paychecks, but you don't get better. They don't improve your circumstances. It just, first of all, none of them can even diagnose anymore. They're no good at that. And you always get a doctor who's, you've never seen this person before, and all of a sudden they're feeding off your file, trying to get to know what your problems are. And, I mean, my own personal doctors, how many times has he misdiagnosed my problems and basically made them worse, giving me drugs that aren't addressing the problem at all, and just complete inability to do their jobs anymore. I mean, I'll tell you something weird. I've seen my doctor for over 30 years, every week to 2 weeks, and that man doesn't even know what drugs I take. In fact, he asked me why I'm, I'll say, well, I need this refilled. Oh, are you taking that? I'll say, yeah. They'll say, what are you taking it for? I mean, this is how connected, this is how much they give a shit. They don't. He gets his big paycheck. That's all he's worried about. And you're in and out the door. And the hospital is the same thing. You get in there. I was in critical shape once, and they wanted the bed, so they threw me out because they wanted to refill the bed. And I'll tell you something, they make more money refilling the bed than they do having you stay there. For example, let's say you had to stay there for a month. Okay, there's X amount of dollars allotted for you staying there a month. But if they could put 10 people into that bed in the month, the bonus is so high that they'll make 3 times as much money putting 10 people in that bed over a period of a month than having one person. This is why you're in and out the door, because really what they want is they want to fill that bed and then get that person out and fill it again. This is where the money is. And this is what the hospitals pursue, not money. So this whole idea that we have health care or concerned medical, no such thing. They're not concerned. They don't give a shit. It's just about money. It's always been like that. And so if you want your health care improved, it's not going to happen. No, as long as there's a bucket of money involved, it's not going to happen. Anyways, sorry I had to tell you all this stuff, but see ya.